next skill we're going to be doing is tube feeding with an NG tube. So the first thing I want to do for this procedure, as well as all the others, is I want to check my order. The physician will order what type of feeding is to be given, what solution, and if the solution is to be given as a bolus feeding, which is by gravity all at once, or if it's to be a continuous feeding, which you'll be using a pump. And I'll show you some things about pumps and closed feeding systems and things like that in the lab when you come to class. It's a little bit difficult to show you on a video. So we'll talk a little bit more about those continuous feedings later on. But for this purpose, for this class, I'm going to show you what a bolus feeding through an NG tube will look like. So I have confirmed my order, I've checked my Cardex, so next I'm going to get all my supplies together. I'm going to of course have a communication method for my patient, maybe a pen and paper or a hand signal or something like that, just in case the patient needs to talk to me while this is going in. Also a syringe. This is a Toomey syringe. You may also see some people use bulb syringes for NG tubes. However, they're a little bit more difficult to use than these Toomeys are. I also need a pair of clean gloves. This is not a sterile procedure once again, so you only need clean gloves. I will also need a towel to put over the patient's chest. I'll need a couple of cups, clean cups, they don't have to be sterile, to pour my solutions in. Next I'll need water, just plain tap water is fine. This is a saline bottle, but we're going to pretend this is water for these purposes since I don't have a sink in here. But just water like you drink. And then the next thing I'm going to need is my solution. Now the physician has ordered in his or her order Jevity, a bolus feeding of Jevity. So this is my tube feeding. So I've got everything together. I've got all my equipment. You can go ahead and pour your solutions right now, but I recommend waiting until you assess the patient. The patient may have a full stomach. Their gastric contents may be too much to actually administer a feeding, so you don't want to have to waste your supplies if you don't have to. So I always wait until after I assess my patient to pour my fluids. So next I'm going to go in the room, I'm going to knock on the door. Hello, Miss Long. I'm going to be giving you your tube feeding today. I'm going to go ahead and get her in the correct position. So obviously for feeding you want them in a high Fowler's position. So once again, I'm going to be putting something into this tube, so the first thing I'm going to check before I do anything is check for placement and check for my bowel sounds. So I'm going to go ahead and listen to bowel sounds. I'm going to place the stethoscope against skin, not over a gown or any type of linens, and I'm going to listen in all 4 quadrants to confirm my bowel sounds. I'm going to go ahead and put on my gloves since I'm going to be manipulating the tube. And I'm going to check my placement of my tube before I put anything into it. So I'm going to draw up 15 to 20 cc's of air. Go ahead and clamp my tube and connect my syringe. Because sometimes this can leak, I'm going to go ahead and put my towel across her chest, just in case. Expose her abdomen. I'm going to place my stethoscope over the area of the stomach. And I'm going to push this air in very quickly. And I heard a swishing sound. So next I'm going to aspirate. Now when you're giving tube feedings, it's especially important to aspirate. A patient may not be digesting the fluids as they should. They may be getting too much feeding, and this is the time to notice that. So when I aspirate, if it's less than 100, I can reinstill that. We'll say I get about 50 cc's of aspirate. I'm going to push that back in. That's fine. But if I pull back a whole syringe, which is 60 cc's, and then I pull back another, that's 120 cc's, and I don't want to put all that back in. That's telling me that this patient is not digesting their feedings as they should, and I need to call the physician and let them know. Your facility policy will let you know what to do in this case. Some facilities may say go ahead and put it back in, but most facilities will tell you to discard and to notify the physician. So now I'm going to clamp my tube and then secure it back. And I'm going to go ahead, usually I've got an emesis basin or something to lay my syringe in that is clean but not sterile. And we'll say I have my emesis basin here. I'm going to go ahead and remove my gloves since I have just touched this tube. And I'll get a fresh pair in here in a little while. Now I'm going to pour my solutions, because I know that this patient is able to tolerate tube feedings. So I'm going to go ahead and pour what I need. So first I'm going to pour my water. And what we usually say is you need to flush with 30 cc's of water before and after feedings. And then I want to pour my Jevity, which is the solution that the doctor has prescribed. So I'm going to pour however much he has ordered. We'll say he's ordered 100 cc's. So I'm going to pour that. You want to make sure when you open these bottles that you lay the cap face up so that you're not contaminating, and you cover the label. So I'm going to pour them out prescribed. Once a feeding solution is open, it needs to be refrigerated. Next I'm going to pour my water. And you can get tap water, is fine. As long as it's room temperature. You don't want any solution to be extremely cold, and you don't want it to be hot. Room temperature is fine. So now I've got both my solutions poured. So I'm going to go ahead and get on a new pair of gloves. Excuse me for a second while I get some more gloves. You're going to want to move your table very close to where you're at, because this flows very quickly. Okay, Miss Long, it's time for your feeding. I'm going to give you this piece of paper and this pen. If you need me for anything, just write it down. If you need me to stop, raise your right hand. So what I do at this point, I'm going to remove the plunger from my syringe, because you want this to flow by gravity. Now, some tubes like G tubes and PEG tubes have been in a long time, and they don't flow very well to gravity, but an NG tubes should always flow to gravity, so you shouldn't have to use your plunger for feedings. So next I'm going to clamp my tube. I'm going to hold it bent. That way no air is flowing through. And the first thing I want to do is pour my water. So we'll say this is my water, and I'm going to pour about 30 cc's. Now your syringe is marked, so you should be able to tell how much you're instilling. So I'm going to pour it to about 30. And when I release, this will run in. The higher you hold it, the quicker. The lower you hold it, the slower it goes in. tubes are a little old here, so it may take it a second. Once I get down to 5 cc's, roundabouts, it does not have to be perfect, then I'm going to pour my feeding solution in. And this may take a minute in real life when you do this, and that's fine. So once I reach 5 cc's of the feeding solution, I'm going to pour in the rest of my flush. So we'll say that's the rest of that. And let the tube flush clear. You don't want to leave any type of feeding in this tube because it will clot and clog the tube. So you want to make sure your tube is flushed completely before you disconnect. So it may take a little bit more flushing. Like I said, the higher you hold it, the quicker it goes in. The lower you hold it, the slower it goes in. Do not want to feed anybody too quickly because that could cause stomach cramping, and it could also cause them to vomit. So I'm going to clamp. I'm going to remove my syringe. Clamp my tube back. Go ahead and remove this gown. It's at the end of the bed. Okay. So after I've completed all this, I usually have a little emesis basin that I can lay my syringe in. You want to make sure that you clean all your equipment. I'm going to remove my gloves. Get Miss Long back into the position. Now, she should stay sitting in the Fowler's position, high Fowler's, for at least 30 minutes after feeding. And then she can lay back down, but at least 30 minutes. I'm going to make sure she's got her call light. I'm going to wash my hands, make sure all my supplies are clean. This syringe can be reused, so it needs to be rinsed and stored, it needs to be dried, and you want to make sure you refrigerate if it's a multiple use carton of Jevity or whatever feeding solution. You want to make sure that it's refrigerated and that you sign date and time when it was opened.